Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lattanza. Hello, and welcome to another episode of the Healthy Heart Show. I am Dr. Lattanza, naturopathic physician here at Natural Heart Doctor. I am joined today by our own Dr. Jack Wolfson, board-certified cardiologist, and today we are discussing the number one killer worldwide and the most common type of heart disease, coronary artery disease. Just wanted to lay out some statistics for you. Roughly 18.2 million adults over age 20 have coronary artery disease. And an estimated 20% of deaths from coronary artery disease are in patients less than 65 years old. It's just too young. So what is going on, Dr. Jack Wolfson, what is going on with coronary artery disease?
Yes, again, it's the number one killer worldwide. And oftentimes, like cancer and some of these, infectious diseases, they get a lot of the publicity. But coronary artery disease, number one killer worldwide. If you look back to the medical literature, prior to the early 1900s, there really was not much talk about coronary artery disease. And I think it really highlights the fact that coronary disease, again, is really just this modern phenomena that's happening, and it really just touches everybody, and it's a very, very important topic that I love to discuss.
Absolutely. I agree that it doesn't maybe get enough credit, and that in 2020, I think that it was over COVID deaths, it was nearly double the amount of deaths related to cardiovascular disease than COVID deaths. So it's very significant, affects us all. We all know somebody with coronary artery disease or knew somebody. So.
It was one of those comorbidities. So if you are someone who's labeled as coronary artery disease, you've had a heart attack, or you've had some kind of coronary procedure, then that also was a comorbidity that increased the likelihood of ICU admission or even death from COVID. So definitely something we want to do. Obviously it's a tremendous revenue source for the pharmaceutical companies regarding all the different pharmaceuticals that are used. We'll touch on that as well, and we'll really give people some good natural alternative solutions to help clear out those pipes.
Exactly. So and it is an evolving process. So we have to kind of take a step back and look at the coronary arteries. So if you would explain, what are the coronary arteries?
Yeah, coronary arteries, and it's funny because we were just talking about COVID and coronavirus. Well, corona is Latin for the word crown, and the coronary arteries form a crown over the heart. At least that's how it was depicted by Greek and Roman doctors or pathologists at the time, if you will. And so there's three main vessels that form these coronary arteries and put a crown around the heart. There's the left anterior descending, there's the left circumflex, and there's the right coronary artery. So three major blood vessels, of course, and they give off branches as well to supply the full spectrum of the heart. So those are the three kind of main ones there. There's also what is truly called the left main, and the left main comes off the aorta on the left side, and the right coronary comes off on the right side. The left main divides into the LAD, left anterior descending, on the front of the heart, left circumflex around the side of the heart. What's commonly known as the widowmaker is the beginning portion of the left anterior descending. That's the widowmaker. But those are the coronary arteries. They're just like any other arteries that supply blood from the heart to the body. And in this scenario, these are the arteries that supply the blood to the heart itself.
Right. So very important to keep that heart muscle pumping with oxygen, full of nutrients. So we have to feed the heart, and the heart is still responsible for feeding those arteries. So this is kind of an evolved process. It doesn't just happen overnight. So what does it mean when these arteries become diseased?
So, when they become, if we say they're diseased, it means that they're starting to become dysfunctional. And what could that mean? That could mean what most people think of are blockages in the heart. Or it could mean just subtle changes where the blood vessels of the heart don't work as well. And that's what's called endothelial dysfunction. And when you have that vessel now that's not working, like you said before, we're not getting enough oxygen, we're not getting enough blood supply, we're not getting enough nutrients to the heart muscle itself. And then, of course, the person could develop symptoms from that. And of course, those plaques can rupture and lead to heart attacks and even death. But that's what coronary artery disease, really means for most people. There are some other subtle diagnoses like, spontaneous coronary artery dissection. It is a possibility. There's coronary spasm, and there's Prinzmetal's angina. There's Kawasaki syndrome. There's different things that can involve the arteries, but typically, again, most people when we're talking about coronary artery disease, we're talking about blockages that lead to lack of blood flow.
Right. So, and we kind of alluded to how common coronary artery disease is, but in your patient population and the population we see here at Natural Heart Doctor, what would we say, how common is coronary artery disease?
Well, I think, again, it's like, the statistics sometimes are misleading because you can see things like 18 million people have coronary artery disease. But if we were to go inside of everyone's blood vessels and you were to kind of take a look around from the inside and take a look around and have a camera and see the vessel walls, see the pipes, if you will, you'd find that just about everybody, certainly every adult, has some form of coronary artery disease, where again, the lining of the blood vessels is abnormal. It's already starting to show changes that should not be present, again, in the normal person. If we were living 5,000 years ago, 50,000 years ago, what would our arteries look like when we're 35? I think it's much more likely now at the age of 35, there's a lot more abnormalities than, of course, how it was, so many years ago. So I think pretty much if you look at, again, the majority of adults, that number could be in the 90 percent area as far as the actual number of adults with coronary artery disease.
Right. And we mentioned this idea of endothelial dysfunction, and it's supposed to be kind of this protective mechanism for the inside of these arteries. So maybe we can, if you want to elaborate a little bit on the endothelium and things in our environment and things in modern lifestyle that really hinder that endothelial function and that protection.
And the actual arteries themselves are made up of multiple layers. So the innermost layer that touches or interfaces with the blood is called the intima, and the intima, the innermost lining of that, is called the endothelium. And the endothelium we talk about very often. It's a one cell thick layer that goes through all the arteries, and that area is so active because, again, that really controls what gets inside the blood vessel wall and what doesn't. And so we want a good, healthy endothelium. And I think all the strategies that we talk about here at Natural Heart Doctor promote the healthy endothelium. So as we talk about later, kind of our overall treatment philosophy and eat well, live well, think well. Well, as we do all those things, it leads to a healthy endothelium. Then we test, don't guess. And then we use evidence-based supplements to help to support that endothelium. And then also, think about, again, the blood vessel, again, is the intima, is that first section containing the endothelium. The middle is called the media, appropriately, and that's where a lot of the smooth muscle cells are. And that muscular layer allows the artery to expand and relax. And then what's called the adventitia is really this outer supportive area that helps to provide nutrients and the nerve supply to the coronary arteries and all the other arteries as well. So those are the main components of the coronary arteries.
So it's like an organ in its own. I think that elaborating on that makes us realize that it's much more involved than just a tube carrying blood. So again, this kind of evolves over time. So how might we expect coronary artery disease to begin?
Well, it's interesting, and I would say that, again, well, if we look back to some of the autopsies that were done on some of the men who came back from the Korean War, for example, and what they found is that 18-year-old, 19-year-old boys had evidence of coronary artery disease. And what we now know really is that coronary artery disease can start when we're very, very young. It can start when we're babies, and actually disease undoubtedly starts in the womb and maybe even preconception. So what does that mean? It means that the diet and lifestyle of your mother for sure, and your father likely as well, even before conception and while you're in utero and in those formative years, all those things lead to the development of that endothelial blood vessel dysfunction, the development of what is called a fatty streak inside the blood vessels, and then ultimately that sows the seeds for overt coronary artery plaque and calcification. So that's, one of our main passions, I know that you and I both share, is that for the health and wellness of the children. And again, trying to reach people as early as we can to get them to adhere to the healthiest lifestyles to really make a difference, so we can prevent coronary disease down the road. But that's why, again, it's just so ubiquitous in society, because this kind of violation of the principles of eat well, live well, think well ultimately leads to disease. And this is the most common manifestation of all the toxins.
Yeah, it's unfortunate, but true. So even if it's, maybe you're born with kind of this predisposition, it doesn't begin with us all the time. Some of these things are out of our control, but there are certain things that we can do through the lifestyle, which we will certainly talk about and we'll get to. But are there any symptoms maybe that we should look out for at a younger age so that we can prevent an outright, sudden cardiac event?
Well, I think, regarding like the symptoms, right? The classic symptoms, for men is like, Levine sign. I like to, there's a show from my generation, which was called Sanford and Son. The actor Red Fox, who played Fred Sanford, he was always clutching his chest, like this. And he's like, Elizabeth, I'm coming to join you, his wife. And again, like, this is the Levine sign. This is the pressure where oftentimes it's not a pain. It's described as a pressure or a tightness that people have with or without exertion. Of course, shortness of breath could be a sign. And then again, where women, women could be sometimes present with those, but I think also we have to be very in tune to some of the different complaints from women. Women, sometimes it's fatigue, feeling tired, don't have a lot of energy. And we have to take that very, very seriously to make sure that that is not some form of a symptom of coronary artery disease. But, when we talk about kind of like other symptoms that we can be concerned about, we've often heard that chronic pain is a sign that you likely have coronary artery disease. Because what that means, when you have chronic pain, that means you're chronically inflamed, most likely. And when you have that chronic inflammation, it's a major risk factor for coronary artery disease. So oftentimes, I think we really need to pay attention to people who do suffer from a lot of aches and pains and stiffness and these different pain syndromes that people have, and understand that, hey, we got to help you with that, but then also we need to check out all cardiovascular issues and make sure you're okay.
Yeah, definitely. I think that that's important to recognize this chronic level of inflammation as a contributing factor to atherosclerosis, plaque formation, coronary artery disease as a whole. So beyond just maybe the differences in men and women, are there other genetic components that can play a role in coronary artery disease?
Yeah, I think for anyone who listens to us at Natural Heart Doctor, I think that most people know our opinion on genetics, and we offer the most advanced cardiac specific genetic testing in the world. But it's just not one of my first tests that I reach for. Again, I'm one of those people who believe that genetically we're built just about perfectly, right? I mean, we can run and jump, and we can see and feel and hear, and we can love and experience emotions, and we can make babies and do all kinds of amazing stuff, right? Why would we be genetically programmed to develop coronary artery disease, blockages of the heart, suffering heart attacks? the answer is we're not. And that really comes into the idea of there are genetics, which is our DNA, and that DNA is the blueprint for protein production, for obviously all things that happen in the body. But it's all about how our diet and our lifestyle and our emotions influence our genes, and that's the concept of epigenetics. So when you plug all the right things in, the right food, the right lifestyle, the right thoughts, you plug that into our DNA architecture, our genetics, we're going to get amazing things. And that's, of course, why you and I and everybody at Natural Heart Doctor always focuses on the basics first. And I think that's what makes us so successful. Oftentimes people are like, oh, well, my father had this, my mother had this, my uncle had this. And that's all interesting, certainly. But again, most people live the same lifestyle as their relatives. And then you should expect the same health outcomes. When you become different from your relatives, that's when you can, expect different outcomes. Maybe one thing, I think you'll agree on this too, Dr. Lauren, that there are some genetic factors to take a look at. We do test everybody, for example, for lipoprotein A, small a, LP little a, and that is a genetic marker. That's important to know on everybody. So I'm not saying that genetics plays zero role. I'm just saying in the healthy person, no matter what your genetics are, your risk is much lower, when you adhere to the right, lifestyle.
Yeah. I often say that, and I forget who says it first, but genetics are the gun and your environment and your lifestyle pull the trigger. So just because of the hand you were dealt does not mean that you will end up with whatever disease your father, grandfather, mother, what have you had. So that does not lay out your fate. We are at the will of our environment and our lifestyle. So we can certainly take the driver's seat in that. So coming from a conventional standpoint, what are the testing? What are some of the approaches at identifying coronary artery disease? Some of the imaging and testing that might be found in conventional standpoint.
Well, listen, if you have, symptoms, chest discomfort, shortness of breath, or you're a woman with fatigue and stuff like that, there may be an opportunity there to do stress testing. I prefer conventional, just plain treadmill stress testing. If they want to do some kind of imaging, in addition to that, then you can do a stress echocardiogram. So you have an ultrasound of your heart before the treadmill, then you go on the treadmill, and then an ultrasound afterwards. That's what I like to do. I'm very against nuclear injections, nuclear material being injected into people for the purpose of, doing the stress testing. There's a lot of problems with that. We've got some good literature on certainly my opinion, on those, types of tests. But, stress testing can be valuable, again, for people with symptoms. Routine stress testing really has no benefit whatsoever. So again, stress testing can help with the diagnosis, but it's going to be significant obstructive coronary disease. So people will experience symptoms when there is a blockage 70% of the blood vessel or greater. So as the pipe starts to shrink down in size, when it reaches an area where it's 70% blocked, that's when people can start to experience symptoms during activity. And then the more and more it gets blocked, 80, 90, 95, 99%, the more it gets blocked, the more easy it is for someone to develop symptoms with minimal activity or even at rest. And then, of course, when it's 100% blocked, that's when someone's suffering a heart attack, when it becomes acutely 100% blocked. And that's where that would be, but there are other tests that we could talk about as it pertains to the diagnosis of coronary artery disease. But, for example, a lot of people are doing calcium scans and coronary CT scans. I'm very anti-radiation. I don't believe that test really has any value aside from motivational to people. So proponents of the test will claim, well, if they have coronary artery disease, then they can go on statin drugs, or we can use aspirin, or we can do certain procedures. Or again, they may say, well, it's motivational. If you tell someone, okay, here's a picture of your arteries and they're very calcified and your scan number is high, that can be motivational. I don't think we should try and motivate people by radiating them and finding them results. And the flip side of that, Dr. L, is that Well, what if somebody has a normal coronary CT scan? Does that mean they could go about their habits of drinking or smoking or poor sleep or poor nutrition or poor physical activity? And the answer to that is clearly no. So the CT scan, as far as my approach, has zero role, and I have not ordered. I've never ordered that particular test. It's just something I don't believe we should be doing. Radiation causes heart disease, cancer, and dementia, and causes people to die. So it's not something I would ever recommend.
Yeah, we do. I know in our practice, we see often patients that will establish with us because they've had a calcium score and it comes back 800-900, and but like you said, even with the stress testing at 70%, that's very significant. And it's pretty late in the game to really start considering it, which is why we always really have to focus on prevention, because 70% occlusion is 70%. Like you're 70% of the way there already to a heart attack. So we have to think about this way early on.
And, and there are other tests that we can, again, you can do ultrasound tests, you can do carotid artery ultrasound, the neck, you can do what's called CIMT to take a look at the neck, even thermography. Sometimes you can see that the blood vessels are very hot, the blood vessels are on fire. So there's a lot of tests we can do that are non-radiation based. Sometimes, as you said, people do come to us, they've already had a CT scan, and we're not going to, admonish you or beat you up for having a CT scan. We're going to try and advise you not to do it again. And again, sometimes even conventional chest X-rays or people who have X-rays for other purposes, they see a lot of coronary calcification, and that winds up sending those people our way, which is great because we can actually talk about helping people as opposed to just sticking them full of a lot of different pharmaceuticals.
Yeah. So you mentioned, 70%, 80%, 99.9% occluded. At what point do you think someone needs a stent or a bypass surgery?
Stents and bypass surgeries are for people with symptoms, and we can decide when to deal, how to treat symptoms. Do we treat it with stents or bypass? Do we treat it with pharmaceuticals? Do we treat it with nutritional supplements? And of course, eat well, live well, think well. Do we do all those things, or a combination of all those things? But we should be able to give people options. And that's obviously what we do at Natural Heart Doctor. We give people options of how best to approach it. Again, if someone's having symptoms, stents or bypass surgery may provide the quickest relief, but we need to let people understand that for people with stable coronary artery disease, so if someone, again, has blockages, or for the last few months, they walk up a flight of stairs, they get chest discomfort, they have an abnormal stress test, the literature is very clear. Stents do not prevent heart attack. Stents and bypass surgery do not prevent heart attacks, and they don't prevent people from dying. They help with symptoms, and even that is a very short-lived phenomenon. So when we show people the data, we show people the studies, and you and I both have these in our presentations, and I love to show these to our patients here. That again, the data, although it seems a little counterintuitive to people when you say, wait a second, if I have a blockage of 90% and we don't need to stent it, you're telling me like that the stent won't prevent a heart attack, the stent won't prevent me from dying? It seems counterintuitive, but the reality is again, it doesn't. It helps with symptoms in that person who has the 90% blockage. Because oftentimes what causes the heart attack is not the 70, 80, 90% blockage, it's the 30% blockages that stents don't address. The 30% blockage, you wake up one day, it becomes 100% blocked, and now you've suffered the heart attack. The stent or the bypass would not have helped that individual person. And then when you put a stent into a 70% blockage, that 70% blockage is actually something that can be very stable. And it's, if you think of it as kind of like this rock hard calcium deposit in the artery, it's not something that's going to break loose. Well, now you stent it, now you stir up the pot, now you mess with the natural healing mechanisms of the body. And we really didn't dive into why does coronary artery disease form, right? Because it's certainly not a cholesterol issue. Coronary artery disease is essentially scar tissue that's occurring in an unhealthy person in an unhealthy blood vessel. So ultimately, that's what we do at Natural Heart Doctor, is that we try and get people to have healthy blood vessels. But it's not like this evil cholesterol molecule attacking our arteries. That's just not the way the body works. Cholesterol comes in as part of the support crew to help the healing of the blood vessel that's been damaged, again, from the violations of eat well, live well, think well.
Yeah. Yeah. It is your body kind of trying to protect and support itself as a protective mechanism. And when we have these stents placed and so on, and the decrease in symptoms, I think that really kind of decreases patient motivation as well. So you have chest pain as this reminder to eat well, live well, think well, and you take away that reminder, then you might take away some of those principles of a healthy foundational life.
Yeah, most certainly. I mean, again, because people go into the hospital and it's like, they get a stent, they're discharged, 24 hours later, and like, hey, I can keep, living my life. But, as far as like that need for stents and bypass, listen, presidents in the 1950s, Dwight Eisenhower, Lyndon Johnson in the 60s, these people lived with angina. They lived with chest pain. They lived with the symptoms of coronary artery disease because, again, there was no bypass. There were no angioplasties and stents and balloons. There was not. All there really was that, hey, you can modify your lifestyle and that'll help. Those were the early days of pharmaceuticals where people could use nitroglycerin and then a couple others, to help with their symptoms. But both of those people, whether it's, Johnson, Eisenhower, and really millions of other people like that, they lived, they lived with this, and they lived for years, with those kind of symptoms. So it's not that, oh, I'm having symptoms, I need to go have a stent. If you want to have a stent, that's perfectly fine, but you need to understand the risks of the stents. You need to understand the benefits of the stents. You need to understand the long-term pharmaceutical use associated with the stents. But that's what we do at Natural Heart Doctor. We give people hopefully that first opinion, but sometimes second opinion on what the plan is. And I think we've been doing very well, well with that for 10 plus years.
Yeah, and I think that we do a nice job also at what we focus on is, should that patient choose to have that procedure done, we really get them in optimal health beforehand so that they can have a better bounce back, rather than going in as a really unhealthy individual, going in for a procedure and having kind of a struggle coming out of that. I think that's really a focus that we.
Well, I mean, listen, we talk about the dangers of radiation. So again, stents is a radiation-based procedure. Doing bypass surgery, you're under general anesthesia. These things have complications. And if you are the healthiest version of yourself prior to these procedures, you're going to get the best outcomes and you're going to minimize long-term complications and side effects from radiation, anesthesia, whatever it may be. If we make you the healthiest version of you, you're going to get the best results.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor.
Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com.
Now back to the Healthy Heart Show.
Exactly. So maybe if they're opting out of the procedure, what pharmaceuticals are commonly used in conventional medicine?
Well, I mean, again, for most people, again, whether they get a procedure or not, they're going to be on statin drugs. That's kind of the poster child of cardiovascular pharmaceuticals, and it's just such a failure. It's just such a abysmal approach. And, unfortunately, again, the literature tells us that for primary prevention in people over 65, actually, you may have a higher risk of dying if you're on statin drugs. And for the general, population, for primary and even secondary prevention, where, okay, you've had a stent, you've had bypass surgery, now you're going to take a statin, the benefits are very minimal. Again, we quote this data very often from March of 22, which in the Journal of the American Medical Association, statin drugs versus placebo in 21 trials showed that stroke reduction is 0.1% a year, heart attack reduction is 0.3% chance a year, and lives saved are 0.2 percent per year. So the benefits, according to their literature, as far as I'm concerned, are very minimal, because our goal is not to reduce someone's heart attack risk by 5% to 4.7%. It's how do we make it 0%? And I think obviously they fail at that pretty, that's just not a good model. We want 0% for our people, and that's where we go at Natural Heart Doc.
And so maybe we can use this to break into our treatment philosophy at Natural Heart Doctor. So if you want to open it up to eat well, live well, think well, kind of what our philosophy is and how to treat and prevent coronary artery disease.
Yeah, again, as we get into the eat well, live well, think well, then that's really what we do. We want people to really understand our approaches to nutrition. We want people to really understand our approaches to living well and that healthy lifestyle, and then also the thought processes. So as we kind of encompass all those different things, that's going to be what we really focus on. And really it's just kind of like that common sense approach that the medical doctors are not taught. Again, when I was going through medical school, residency, cardiology fellowship, on the job for 10 years in the biggest group in the state of Arizona as a senior partner, it's just not one of those things we ever talked about. We never talked about nutrition. We never talked about, hey, what is the healthy lifestyle and the healthy thought processes? And it's all in the medical literature. It's all there for us to see. And even members of the public, you can go find all this information that you want. It's all there. But again, the cardiologists from day one were taught about statin drugs. We're taught about that miserable failure, of aspirin. We're taught about, blood pressure drugs. And again, we just need a much better approach, and that's where eat well, live well, think well, came up.
Yeah, I think that this idea of evidence-based medicine, we have to realize that it has farther reach than just pharmaceuticals. Eat well. We have the literature that supports a paleo approach to diet, having plenty of omega-3s in the diet, and as a preventative mechanism for preventing atherosclerosis and coronary artery disease. Sunshine exposure decreases risk for plaque formation in the coronary arteries. So like you said, the literature is there. It's all evidence-based medicine, but evidence-based medicine does not have to equal pharmaceutical drugs. So let's talk about eat well, if we can dive mostly into that. So I know that we stand firmly with a paleo approach to diet, but let's talk about that as relates specifically to coronary artery disease.
Yeah, as far as, the eat well philosophy, again, we all debate about nutrition, but we never want to lose focus on the live well, think well components. But again, since everyone likes to talk about eating well and diet, let's talk about that first. And my education in nutrition was zero, but as I would meet my wife, and she opened up my eyes to all things health and wellness, and I started to read about different nutritional philosophies. To me, I kind of came up to that ancestral diet. How did our ancestors eat for so many years? What are the foods that we ate? What are the foods that we did not eat? And that's really ultimately the common sense approach. It's only us humans that debate what to eat. Like a lion knows what to eat, a tiger knows what to eat, a cow knows what to eat. But for some reason, the humans argue about this. Yet, if you look at the paleontology literature, the anthropology literature, you can see again that we are hunter-gatherers. If you look at modern day survival shows, Alone, Naked and Afraid, Survivor, you can see these people, they're hunter-gatherers. So it's very odd, and even modern paleo peoples, that when we live that hunter-gatherer diet, that is obviously optimal. And then what we try and do is we bring that into the 21st century. So ultimately for people, we tell them, eat a lot of wild seafood, eat a lot of free-range grass-fed, nose-to-tail animal products, eat the eggs, eat the fruits, eat the vegetables, eat the nuts and seeds, the avocados, the coconuts, the olives. We get people away from eating a lot of grain. We get people away from eating gluten. Dr. Jack Wolfson, my family, we never eat gluten ever. And then the ultimate thing is that no matter what diet you're following, no matter what you're eating, make it organic. So I'm not condoning eating ice cream, but if you're going to eat ice cream, make it organic. If you're going to have chocolate, make it organic. If you're going to have a pizza, again, make the ingredients organic. Let's all agree to get the chemicals, the pesticides, the synthetic fertilizers. Let's get that out of our diet. But again, if I had to pick one food that was the penultimate strategy for cardiovascular and coronary artery disease health and wellness, it's seafood. We know that people with the highest levels of omega-3 from eating seafood have the lowest risk of everything. That's our strategy. That's our strategy.
Yeah, and it's really hard, and I know that we've talked about this before, but it's hard in this kind of modern age to avoid some of the additives, be it pesticides, herbicides, seed oils that are just kind of omnipresent in processed food. So if we can avoid things with labels, just eat real, whole, organic foods, we minimize some of these really easily oxidized inflammatory particles in our diet. And kind of keep it in better control when we know exactly what we're putting into our bodies. It really minimizes some of those risk factors from the diet. So you mentioned seafood. I think that we can both agree that, eating organ meats, so like cures like, if we talk about, consuming grass-fed, beef heart, that's supportive of our heart. So eating nose to tail, like you mentioned, be it seafood, or organ meats as well. I think that that's going to be really supportive of a healthy heart.
Also, we didn't touch on that. You and I have often talked about the leaky gut, leaky heart. So it's like as we eat these certain foods, and obviously there's other factors that lead to leaky gut, where things get into the body that don't belong. Well, leaky gut leads to leaky heart. And leaky heart really starts with those leaky coronary artery disease and coronary arteries. As that endothelium, that lining of the blood vessels, as that starts to leak, things get into the inside of the blood vessel, sets up a lot of inflammation, oxidative stress, immunodysfunction, and you ultimately wind up with coronary artery disease. And again, that just starts with so many times in the gut and so many of these unnatural foods that don't belong in our guts. And that just leads to leaky gut, leaky heart.
Exactly. Yep. We have to kind of look to the past in terms of knowing that healing begins in the gut. We have to stop with the processed foods. So eating an ancestrally appropriate diet, certainly. So now let's look at live well. So living well with to prevent coronary artery disease, of course, things, like not smoking, but what else can we talk about with things that we should include?
Well, we always debate about, the different foods, but again, is food any more important than sleep? The answer is no. Sleep is probably the most important thing we get. We know from the literature, again, people who sleep 6 hours and less, they have a much higher risk of heart attack, stroke, and everything else. So we want to make sure we get our good quality sleep. We go to sleep with the sun down. We wake, before the sunrise. We watch the sunrise. All those kind of activities are beneficial. But no matter what version of the story we believe in, whether it's the biblical version or the evolutionary version, first it was darkness, and then there was light. So our ancestors, and again, all plants and bacteria and all animals, they grew up with and evolved with this circadian rhythm. And in that circadian rhythm, it really allowed for, again, the importance of, sleeping at night, awake during the day. And then, of course, that would get us into the next component of living well. So first there's the sleep, and the second is being outside, outdoors, and in the natural light, and using our skin as that solar panel to collect the light. And as you alluded to as well, where that the power of the sun, the light, the radiation, the UVA, the UVB, the UVC, the infrared, the visible light spectrum, it comes right into your heart and helps to clear out those arteries and keep your pipes clean. And, you and I can talk about this on a deep scientific level for hours and hours and hours. But in general, people just need to understand what makes common sense. Get outside, get in the sun. Physical activity is another part of living well. The more we do that outside, the better. And then, of course, avoiding environmental toxins and chemicals and pollutants. We want to make sure that is a part of our plan inside of living well. We have a lot of this information on the website where we break this down pretty heavily. And then, of course, dental health, oral health is absolutely critical. Chiropractic care, physical medicine, and self-care, is critical. And, those are all those different components of living well.
Yeah. And like you said, we can break the whole sunshine component down on a very scientific level, talk about the receptors in the retina and how this hormonal cascade occurs. But what I often just tell patients, like we know, we can think about it from a very common sense perspective. We know if we bring most plants inside and don't allow them sunshine exposure, it's not going to thrive. So we're a much more, evolved system than just a house plant. So we need to realize we've got a lot more necessity for sunlight. So we got to get outside. Modern day life is not just wake up, go to your covered car to your covered indoor environment with false light. That's not going to set you up for a vital life.
I mean, all life is outside. I mean, and humans have been outside since the dawn of human existence. It is only now, again, that so many people just spend their lives inside, in the artificial light, sitting in a chair, physically inactive. Right? When you think about blaming that on genetics, how could we possibly blame this on genetics when we're sitting at our desk, typing away at a computer all day long and having a soda pop while snacking on potato chips and candy bars? Like, where does genetics come into that? That is a problem. It's just not. It's clearly our lifestyle. And I'm not saying that living this kind of way that you and I, teach everyone to live. I'm not saying it's necessarily easy, but it's the answer.
Right. Yeah. I would love to know the statistics of the hunter-gatherer societies and their coronary artery disease when they're living outside, moving all day, right? Living and sleeping by the cycle of the sun. So it's just an evolved disease that our modern lifestyle has brought upon us.
And there's no evidence, again, at all that animals in the wild, for example, and some of the closest animals that we would say are to us, have heart attacks and strokes. They don't. They don't. They aren't dying from those things. Those are man-made from the toxic, unhealthy, man-made lifestyle.
Yeah, good point. Okay, so that leaves us with think well. So thinking well as it relates to coronary artery disease.
So again, it's like our thought processes, they matter, very much as well. So again, it's like the eat well, live well, think well process is absolutely critical. We want to, the think well component is just as important. We know that mental health issues are a serious problem. We know that people who they have anger, anxiety, stress, depression, all these different issues, they're at much higher risk of cardiovascular disease. So we want people to understand, find your happy, minimize the stress, change your life, do the things you need to do in order to find your happy. That's going to be your salvation. Yeah.
Yeah. And, we all grow up in different environments, and there's certain traumas, there's certain stressors, from a young age to, well into careers can be stressful, but chronic psychological stress does significantly increase your risk of atherosclerosis and plaque formation in your coronary arteries, and directly increases your risk of heart attack and stroke. So although we, can't always avoid stress, we do have to have in place healthy ways to manage the stress and surrounding yourself with a supportive environment and supportive people that you enjoy.
Right. Well, clearly our ancestors never had chronic stress. We had an occasional stress. And when you're under chronic stress, it doesn't allow your body to heal. It doesn't allow self-maintenance that goes on in the liver and the heart and the kidneys and the muscles and the heart arteries themselves. So when your body constantly thinks it's getting chased by a tiger and it's always under stress, our prehistoric brain thinks it's getting chased by a tiger. Again, that self-maintenance doesn't happen. Your repair mechanisms that are going on to help keep inflammation down, they're not there. So we got to get out of that constant sympathetic overdrive, that constant overly stressed mentality. And again, with anger and social isolation and all these various things, depression, all these things that happen, it's something that needs to be addressed. And it's very clear. The medical doctors, they'll reach for Prozac. That was chapter 5 of my book. One Nation Under Prozac was the name of the chapter. And the answer, of course, is not Prozac. The answer is to find out why you have these mental health and emotional issues and work to solve them.
Right. And I think also adding on to that is a mental standpoint on things. So whether you think you can heal or whether you think you cannot, you are right. So we have to put ourselves in, a positive light and a positive mindset to be able to move forward with healing. That whole healing process does not start unless you have wrapped your head around, I can heal, I can do this.
And I think that's really just fantastic information, that you just brought up, Dr. Lauren, that, it's kind of like sometimes I talk about fasting as a strategy to reverse coronary artery disease. And as we fast, again, our body starts breaking down the coronary plaque to use for food, to use for fuel. But I want people also to visualize that, right? To visualize their coronary arteries. And when you close your eyes and you think about the arteries, and when you're eating this way, and you're living this way, and you're thinking this way, and even things like intermittent fasting, and you visualize, again, that plaque is just slowly dissolving. And we have evidence of that. We've got people who have done coronary artery scans against our wishes, and we've seen before and afters, and we're seeing tremendous results in these people when they follow our plan: eat well, live well, think well, and then springboarding us into the test, don't guess, and then ultimately into the evidence-based supplements.
Yeah. So I know here at Natural Heart Doctor, we like to use, blood, urine, different tests, but I think that a really important component of that testing would be maybe our level 2 testing. So maybe you want to explain why that would be so relevant to this disorder.
Yeah, most people, they get the 1970s testing when they go to their doctor, total cholesterol, LDL, HDL, triglycerides, and they'll look at some of the, kidney and liver enzymes, and they'll get a complete blood count to see if they're anemic. But again, there's a lot of information inside of those. But the way that we do it with our levels of testing, levels 1 through 4, and so many of our people do kind of start off with that level 2 testing. Those are 6 tests that are just the penultimate deep dive into all things health related, and certainly coronary artery disease. So as we look at all the different advanced lipid markers, and that lipoprotein A, Lp(a) that we talked about, and all the markers of inflammation, oxidative stress, and we talk about things like uric acid, and we talk about homocysteine, and we're looking at hormones, we're looking at advanced thyroid and advanced metabolics like insulin levels and A1C levels and fasting glucose. So, we're looking at all these different parameters that give us a very good insight. And then also intracellular vitamins and minerals and glutathione. People with the highest levels of glutathione, lowest risk of coronary artery disease. What's your glutathione level? Don't you want to know, and don't you want to bring it up? Raise the level as a strategy, as opposed to, well, you had a coronary CT scan and you've got coronary artery disease. Now what? Well, we're going to run you through the ringer with our tests. We'll do the advanced intracellular vitamins and minerals and glutathione and omega-3 levels that are so critical, again, to know. And then, vitamin D, we talked about intracellular vitamin K2, right? K2 keeps the calcium in the bones and out of the arteries. And then we do the leaky gut testing with the wheat zoomer, looking for gluten, wheat sensitivities, leaky gut, leaky heart. And then we do the triple toxin test for metals, 30 different mold mycotoxins, over 40 different environmental toxins. And we're just trying to give you the cause of why you have these issues, or help you to prevent these issues. And there's a role for this testing in absolutely everybody. And, you and I both do it on so many people, and we change so many lives. And that's what our strategy is, right? Is that we check at kind of, at the first day that we, in our first meetings with people, we check at the beginning, and then we kind of come up with that comprehensive plan, and then we test them a few months down the road. And when people follow the plan, they just do spectacular.
Yeah, we see tremendous results when we, and knowledge is power. So we gain all of this information, all of this insight into the risk factors of the individual, so that then, on that follow-up appointment, we have an individualized treatment plan for them. So, maybe you eat really well, but your body system is telling you that, you've got some insulin resistance, or you've got some oxidation going on. You do have mold exposure, despite the fact that you just built your home and you swear that there is no mold in it up and down. But having that, black and white in front of you, sometimes when it's, circled in big red numbers, we have to identify that. And then, we work to prioritize and personalize the treatment for that individual.
Yeah, most certainly. And that's why, again, we get such fantastic results. And, this doesn't have to be separate from the medical system. Again, we can work, with people, again, who are on pharmaceuticals, and under the care of another, cardiologist. But again, if you want the ultimate strategy to prevent, treat, and reverse coronary artery disease, this is what you and I are talking about.
Right. And, most mainstream can order the majority of the testing that we're talking about. So even if it is just that they're testing maybe homocysteine levels or lipoprotein little a levels, they can order these tests. But then we have the really, I think, specialized in-depth testing that really doubles down and identifies some further risk factors.
Well, I mean, the conventional cardiologist doesn't really feel the need to do advanced lipid, cholesterol analysis, because they're going to put people on the maximum dose of statin drugs anyways. So it really doesn't help them too much, as opposed to, hey, we're looking at the apolipoprotein B to A ratio, and we're looking at LP little a, and we're looking at some of these other factors. And again, the more we improve all these factors, the longer and better people are going to live.
Right. Yeah. So if they don't have a pill for that corrective mechanism, they probably just won't order it. So that's unfortunate, but true. So maybe rather than pharmaceuticals, we can talk about some of our evidence-based supplements that we know are tried and true in preventing and reversing coronary artery disease.
Yeah, well, certainly, some of our favorites, certainly high-dose vitamin K supplementation based on our testing, vitamin K2 supplementation. That's got some fantastic literature, and more is being produced every day. We love this other product called Arterosil. And Arterosil, Arterosil, they've got a fantastic website, arterosil.com, where they've got a lot of videos explaining how their nutraceutical supplement helps that blood vessel lining, which is so critical. And that product actually has a United States patent for stabilization of plaque and even plaque reversal. So that's a great product. Again, I love the product Heartbeat and Vessel Support as nitric oxide producers to help to open up those pipes so blood flows better. But pretty much anything we can look at that would help to improve lipids, help to improve inflammation, help to improve blood sugar control. For example, our product OptiLipid, which is 6 different nutrients to help to support not only healthy lipid levels, but also lowers inflammation, lowers oxidative stress, helps improve blood sugar and insulin resistance. So there's a lot of different things that we can use from an evidence-based supplements approach. But ultimately, it'd be nice to test the person first, start them on Eat Well, Live Well, Think Well, put them on a supplements regimen that's beneficial, and then ultimately, see how they do after a few months. And then I do want to mention, of course, our new product, which is Kickstart My Heart. And we talked about those organs, and Kickstart My Heart is from American bison, free-range, grass-fed, grass-finished bison. That are just majestic animals, and it's a 4-to-1 ratio of liver to heart. There's nothing more nutrient dense in the world than animal liver, and the heart does pretty well by in addition. And of course, we're talking about people with heart issues, and you mentioned the concept of like supports like, and that's where eating heart comes in. And whether or not you eat the heart, you can certainly take our Kickstart My Heart capsules.
Yeah. And I think within that, I wanted to really mention like CoQ10. And that's a component within the heart tissue that's in Kickstart My Heart. And I really love that because it can take the place of like a multi and it's really so many supplements that the Kickstart My Heart just kind of really fills in those gaps that we wouldn't gain elsewhere, especially from our plates. We just second to none. But I know that like the research on CoQ10 in cardiovascular disease and inflammation, and I was recently listening to an interview with the late, great Dr. Steven Sinatra, and his early work on CoQ10 was within 1 to 3 milligrams, I think. So just very, very low dosing. So we know that we've come a long way in that. And so I think CoQ10 has definitely earned its name on that list of the evidence-based supplements for cardiac prevention as well. And I would definitely look at Arterosil if you haven't heard of it from us. Check them out because it's rare to find supplements, with a brand name on it that has a study on that exact supplement. So Arterosil is just excellent at providing support and reversal in that endothelial lining. And I know I've seen in patients, and I'm sure you have as well, Dr. Wolfson, I've seen a carotid intermediate thickness scan and reversal of plaque from all of these evidence-based supplements that we do, and no pharmaceuticals on board. So it's just incredible the work that we can do. So how is it that we can take a patient maybe that comes to us with a whole list of pharmaceuticals? So how can we reduce and eliminate pharmaceuticals from these patients?
Well, I think, again, it's working as with people and patients as partners. And how can we, again, talk to people and show them the data and say, okay, listen, this is the data on statin drugs. I don't think it's very impressive. And if you would agree, then again, that's something we can, typically stop statin drugs, immediately without any kind of weaning process. People on aspirin, kind of same thing, other blood thinners. Again, just like having that discussion about what we do with all these different pharmaceuticals. And oftentimes, again, that's we can reduce or eliminate all the pharmaceuticals for these people, and we don't just do it with a shotgun approach. Again, we discuss the risks, we discuss the benefits of these drugs, and then let the patients decide. And again, working in a partnership as opposed to the traditional medical doctors, where hey, it's my way or the highway. Here's the pharmaceuticals. Don't ask any questions. I think people deserve better from their healthcare practitioners, and I know we offer that.
I would agree. I think that a lot of patients come to us and we hear there's a lot of fear tactics involved, especially as it relates to coronary arteries. It's as serious as a heart attack, as they say. So they use a lot of fear tactics to instill that this is the only approach. If you don't do this, then this is your fate. So we work, like you said, on that, cost benefit analysis, the risk benefit analysis with every patient, meet them where they're at, explain what evidence there is. So I think that that's a really important approach to our treatment here. So if this sounds like you or somebody that you know and love, and you want to identify your risk factors and prevent any cardiac illness in your life and get to your 100-year heart, I would highly encourage that you look into becoming a patient with us, scheduling a free 20-minute health coach call here at Natural Heart Doctor. Going to naturalheartdoctor.com. You can find us on our private Facebook group, Natural Heart Doctor, on Instagram, Natural Heart Doctor. Any last minute additions of how patients can work with us, Dr. Jack Wolfson?
And don't forget TikTok too. We're going to ramp up.
We're going to be on TikTok. We're coming.
TikTokers, again, and I think, I so appreciate having you, Dr. Lauren, obviously a Natural Heart Doctor, and what an asset you are to all the patients and all of the potential patients and all the people in the world as we get this information out there. It's your level of intelligence and knowledge regarding heart health, and among so many other things, obviously, that you're very skilled at when it comes to overall, general health. But, the fact that you're able to address this from a preventive standpoint and a causative standpoint puts you light years ahead of the other cardiologists. Certainly if I was going into the emergency room with a heart attack, I wouldn't be looking for Dr. Lauren Lattanza as much as I wouldn't be looking for Dr. Jack Wolfson. I'd be looking for somebody with a balloon and a stent to help open up my blood vessel to prevent a worsening of a heart attack or a bigger heart attack. There's value in that, and God bless the men and women physicians who work in the emergency situation. But when we're talking about prevention, when we're talking about primary prevention, secondary prevention, those medical doctors have nothing. And that's where you and I, really shine and can help people to keep them out of the emergency room, which I think we're really good at. So again, I'm so appreciative to you. Anyone who's listening to this, listen, grab a call, grab a free coaching call, hook up with Dr. Lattanza, one of the coaches, with myself. Read all of our information, share our podcasts, share our videos. Sharing this stuff may just save someone's life. Again, the more we share this health and wellness information, the more we're going to help people achieve that 100-year heart. So, thank you all for tuning in.
That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @cardiologycoffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.